There was indiscriminate bombing of Mogadishu at that time. The violence was so extreme that you couldn't walk the streets with any safety. And there's so much work to be done. And there are so many people who are suffering so greatly, and every minute counts, and every decision you make counts. You don't think about the fear.
International Medical Corps is a first responder.
We're a training organization. We build self-reliance. We reach out to people in the hardest hit areas of the world, and we help them rebuild their lives.
Here at International Medical Corps, we prioritize training.
We can actually give people the tools that they need to have more direct input into their health systems.
The way we really have the best impact is when we train people who live in the various countries that we're working in to carry out the work themselves in their own communities so that we're not needed.
This is not a usual job.
Our work is our people.
Individuals with a lot of oomph who did not panic.
They give up the things that they are doing to fly to a dangerous place on 24 hours notice to help other people.
We work in some very harsh places.
Throughout the past few years, we've been in every emergency in no time at all.
With the onset of an emergency, we bring in doctors, nurses, logisticians, administrators.
Once the earthquake hit, we were on the ground, I believe, within 22 hours.
We went towards the front line. We started providing the shelter, the tents, hygiene kits.
We were taking 85 casualties a day, gunshot wounds, saving many, many lives.
But our approach is to immediately reach out during the emergency response to people in the local community and quickly bring them in to being a part of the solution.
We recruit national staff and we train them for almost everything from medical management to financial management.
International Medical Corps was founded by Bob Simon. He believed that people had a right to health care, and so he decided as an American doctor he was going to go to Afghanistan and do what he could.
There was no health system functioning. There was absolutely nothing functioning. Now, currently, the doctors that we trained are in charge of the Ministry of Health. They're running the hospitals and the clinics without any support.
The niche behind the organization is the training, self-reliance, restoring the infrastructure.
If we help people in their communities, we are going to give them a reason not to be so afraid and a reason to stay in their communities.
We went in with the first mobile clinics, and word had got out to the local community. They were throwing flowers in front of us. That just blew me away.
We managed to give him fluids. We managed to give him antibiotics. I kid you not, after like several minutes, he literally was like this. And he just came back.
And at the clinic, we've got an immunization program. We've delivered an X number of babies.
And the mother was happy and calm, and they were safe in one of our hospital wards under a mosquito net, and everything was as it should be.
And if we haven't brought that incubator, her child wouldn't live.
You teach them the skills to bring the patients back, and they're almost the ones that are shocked, thinking of how many patients they could have saved before if they'd known.
The resilience that you see in the face of so many challenges and disasters is just incredible. I've seen people lose family, lose homes, and still be able to do what they can for somebody else. It's really given me hope.